Hello everyone. Today we will talk about pressure of the needle, pressure of your strokes. I'm going to show you an exercise that you can do by using a simple gloves and drawing on your own hand that will help you to feel pressure, to feel the pressure that you need to use for dry skin and the pressure that you need to use for oily skin. So I'm going to put, you see my hand is clean. The needle is clean, it's sterilized. I just put a new cartridge into the handpiece. I'm going to. So what you want is to have your glove to be tight, and then you want to create a fist so that the glove is going laying tightly over your hand. I'm going to put my power supply on 5.9, 5.8, 5.9, taking a little bit of ink. And by the way, this is how we test, right, to make sure that everything is working properly. I'm going to show you while we're on this. So anytime before you start drawing on your clients, you want to take a clean cotton piece and create a few strokes just to see that the ink is flowing nicely. Alright, so here we go. The goal here is to color the glove, don't color the hand. So you might feel slightly a little bit of tickling sensation, but it's not painful. You shouldn't feel any pain. And I want you to try different types of strokes. Try medium-sized stroke. Try to create a long stroke and a small size stroke, just to see how it feels. What's the difference? This is the pressure that you're going to use on a very thin, dry skin. And if you look at the board, you'll see I have a few gloves drawn for you. One glove that says 1 and the other glove that says 2. So that is a pressure. That is a pressure that you will be using. Pressure of 1 glove and pressure of 2 gloves. And right besides, you see that the circumstances where you're going to use 1 glove and when you're going to use 2 gloves. So 1 glove you're going to use for someone who has really dry skin, thin skin, mature skin, your clients who are 50 plus. Sometimes that clients who have mature skin, it might look that it's kind of normal to oily, but you have to be careful with it. Mature skin is a lot thinner than it seems, so you need to work carefully. I want you to just practice doing many gloves, maybe like 10 gloves for dry skin once, until you really can feel. You can feel it with both hands. You can feel it with your right hand doing it and with your left hand, how it feels like. Alright, so this is 1 glove. I'm going to try to remove this. You see the ink is in the glove, right? Nothing is coming off. And then we remove the ink and there's nothing on my hand. It's clear, it's clean. So that's 1 glove. The second exercise is we're going to do the same thing with 2 gloves. I have 1 glove and I'm going to put a second glove right over it. And this is going to represent oily, thick skin. I want you to feel how to work, what kind of pressure you have to use for oily, thick skin. We're doing the same exercise, but now your needle has to penetrate both gloves. Should not be painful. Your needle is gliding through the glove, kind of gliding, scratching, leaving imprints. When you remove the second glove, you're probably going to see a little bit of color in the second glove, but your hand needs to be clean, and this should not be painful to you. You should not feel the needle. When you start working with clients, when you start working with real clients, real skin, what you need to do, let's say you're going to start your coloring from the tail, right? Tail up. Let's say this is your tail right here. Right, this is your tail. So you are going to start from the bottom. This is the bottom of the tail. You are going to start like not right at the tip, right at the end of the tail, but somewhere near the end. You're going to start coloring, and you are going to create, I would say, a couple strokes, just a couple like this. Then you're going to stop. You're going to take a Q-tip. I don't have a Q-tip, I have a regular cotton, and you are going to remove with a small Q-tip just that area of the tail to see where is the ink. And what you should see tiny little dots of ink. What you should not see is any blood. You should not see any dark colored imprints, dots. Dots have to be barely noticeable. That means you're in the right layer of the skin. That means you can continue with the same pressure. If you don't see any dots, then that means you need to add a little bit of pressure. And as I said, if the dark dots are too dark, if they look kind of grayish, bluish, dark, that means you went way too deep. When it heals, you will see that you worked a little too deep. So you need to go lighter. So 2 gloves. This is the pressure that you are going to use on clients with oily skin, clients with thick skin, thick oily skin. Anybody who is younger than 25, normally your young clients, they do have pretty thick skin. Even if it's dry, it's still pretty thick. And now let's see, I try to remove. The ink is in the glove. I'm removing my first glove. I see just a little bit of ink here, not much. Actually, it's okay if you see more ink. And of course here is nothing. So here, that's your exercise. You should do several of these gloves at home, at least 10. One glove, 2 gloves, until you really can feel and see the difference between having 1 or 2 gloves on your hand. So here I have a little cheat sheet for you. You can write it down somewhere for yourself to remember. This is a pressure of 1 glove. This is a pressure of 2 gloves. 1 glove. Pressure of 1 glove you're going to use on dry, mature skin, very thin skin, your clients who are over 50. 2 gloves, oily skin, young clients with less than 25 years old, anybody who has thick skin. And I drew a model of just the normal skin. So when you're working on eyebrows, you have to adjust your pressure. Any skin, normal, oily, dry, everybody has a different thickness of the skin in different parts of the eyebrow. Skin is much thinner at the arch and at the tail of the eyebrow, and it's much thicker at the body and the head of the eyebrow. So what you should remember, because you're going to be starting always to working from the tail going up, as I just showed you, you're going to start coloring somewhere over here at the bottom of the tail. You're going to create a few strokes very lightly. You're going to wipe it and see what's in the skin. If you like what you see, the dots, the marks, the imprint that's left, you see just a tiny little bit of color, small dots, then you can continue with the same pressure. If you see that you went too deep, if you see blood, that means you're way too deep. should never see any blood, that means you need to go lighter. So tail, this is a normal skin. Client, this is, I would say, probably anybody 25 to 50 in that age range, normal skin. The tail, pressure of 1 glove. The body, especially the lower part of the body, that's a pressure of 2 gloves approximately. Everybody's going to be slightly different. There's so many different skin types, age groups, so you will learn after working with clients, after working on many different skin types with many different clients. But until then, it's better to use lighter pressure. It's better to go lighter than too deep, and then the client comes back and the ink is way too deep and those eyebrows need to be removed. So always go slightly lighter. If you don't know, if you are unsure, go lighter. If the client comes back and you won't see a lot of ink there, that's okay. You can spend a little extra time, do one more procedure, and your client is going to be happy and you will be happy. You'll be learning. So I hope this lesson was helpful to you. Practice, 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 and I will see you in our next lesson.